Hello, my name is Garth Reynolds, the Executive Director of the Illinois Pharmacists Association, and welcome to the role of Illinois pharmacists in a public health emergency. Over the next number of slides, we will review the role of pharmacists in public health emergencies, discuss the components of the State Memorandum of Understanding for Pharmacies, local health departments, and the state. Let's talk about the role of the pharmacist. So why pharmacists? We already know that pharmacists are the most accessible healthcare provider in our communities, ideally located in our communities, and we are set up to provide care. We encourage our patients and our team to prepare themselves for an emergency. Pharmacists have proven themselves capable to assist in public health emergencies, such as the H1N1 crisis in 2009. So let's take a look at the role in seasonal and pandemic immunizations. Pharmacists already play an important part in providing immunization care. Over 260,000 pharmacists provide immunizations. 20% of all seasonal influenza vaccinations of adults are administered through a pharmacy or community setting. Pharmacists have become even more crucial during a pandemic, such as was observed in the H1N1 crisis in 2009. The pharmacists were still underutilized but played a very important role. If vaccines were provided in a more timely way, the time to vaccinate the public could be reduced significantly, and widespread vaccinations at the peak of disease would have little impact. This chart illustrates the public health need for community pharmacies to protecting the public during a pandemic. Without pharmacies, it would take almost 19 weeks before the community would reach 80% of an adult coverage level. But with pharmacies, we could reduce that time frame to 11 weeks to 80% coverage. So let's take a look at our planning from a pandemic point of view and a seasonal point of view. From a seasonal point of view, most of our planning is very routine. We get into our schedules with the seasonal influenza distribution and ordering process and the administration process is pretty much unchanged from year to year. Whereas on a pandemic level, it needs to be from a top-down approach, where we need the federal government working with vaccine manufacturers not only to develop the supply in a quickly fashion, we need state health programs to be able to receive the allocated vaccine and manage its order and distribution. And then healthcare providers need to be available to vaccinate the public. And of course, there needs to be tracking and documentation and looking at if additional doses may be needed depending on the situation, and that the affected groups are vaccinated first. So also we have to look at all the different services that a pharmacist may provide in their community, whether it's administering vaccines or other immunization care, dispensing medications on a mass scale, whether it's a post-exposure or prophylaxis, emergency refills, including chronic medications, providing needed medication education and patient counseling, and establishing our practice sites as point of dispensing and points of care during an emergency. Pharmacists need to also consider being a volunteer in Medical Reserve Corps and also assist in mitigating medication shortages. So let's take a look at some related literature. Defining the role of pharmacy personnel in disaster response and emergency preparedness. And this was published earlier this year in Disaster Medicine and Public Health Preparedness. And they looked at developing a framework to review and assign pharmacist personnel based on their core capabilities and developing a classification scheme and looking at their roles and responsibilities throughout the disaster. And this looked at the entire pharmacy team. Granted, we're focusing a lot on the pharmacist role today, but we also need to recognize the role for student pharmacists, certified pharmacy technicians, our pharmacy technicians, and of course our non-pharmacy personnel. This study came up with putting the entire team into 4 different categories based on various components, looking at their education from a category 1, needing no pharmacy-related education, all the way to a category 4, where it is going to be a pharmacist job because you need pharmacy-related education with degree or diploma in pharmacy. And it goes through and talks about their various experience, skill sets, tasks, independent level of independence, and some examples of what those tasks would be. And this was very helpful in our discussions when we were looking at the Memorandum of Understanding and trying to develop the process and look forward to what the roles would be in the various pharmacy teams throughout the state. Integrating pharmacies into public health program planning for pandemic influenza vaccine response, published in 2016 in Vaccine. The authors here assess the relationships and activities between pharmacies and public health departments, and they examine 3 different areas: engaging, recruiting, and enrolling pharmacists as vaccine providers, vaccine allocation and distribution planning, and policy and formal agreements and memorandum of understanding. And they established different recommendations for these MOUs between public health departments and pharmacies. And the goal is to increase coordination, increase communication, and advance the roles of pharmacists in emergency response. This article was a guide to us in the very early stages of our process in looking at how to develop the Memorandum of Understanding. Pharmacy services after a tank car derailment and toxic chemical release in Blount County, Tennessee. This was published in March in JAFFA and looked at the post-response in a public health emergency in Tennessee and surveying pharmacists after the disaster in the various areas of disaster preparedness, response, information sources, what changes may be needed to the Pharmacy Practice Act, and overall pharmacy impact. It is interesting to note that disasters have the potential to affect all pharmacies in a locality, but appear to have a significant impact on those located close to the scene. We may think this is a common sense statement, but it is very important for us to start to examine how pharmacies can be utilized in a public health emergency and the role that pharmacists may play. So pharmacists would benefit by an awareness of current disaster information sources and other legal sources pertinent to our practice in the time of a disaster. So let's take a look at a broader policy review on this topic. The Illinois Department of Public Health and pharmacists. Together, we have coordinated on following emergency preparedness programs and initiatives. We already talked about the pharmacist's involvement in H1N1 in 2009. We helped develop strategies for that response. In addition, pharmacists in our state have helped with presentations on the roles of pharmacists and pharmacies in this area back in the 2015 Illinois Public Health and Healthcare Coalition's Preparedness Summit. And we also finished a version of this panel program, which this module is a segment, at the 2017 Public Health and Healthcare Coalition's Preparedness Summit. The American Public Health Association recognized the importance of the involvement of pharmacists back in November of 2006, stating a confluence of events has refocused our attention on the role of pharmacists can play in public health planning and emergency preparedness. The importance of medication distribution and patient care during disasters is vital. NABP also looked at this area and came up with the following bullets, saying that we need to have a model structure on creating an emergency and disaster and preparedness plan, working with our states to enact emergency dispensing and other related provisions, develop and maintain a contact list of local state agencies and national pharmacy organizations, and a contact list also for local and regional manufacturers, wholesalers, pharmacists, and technicians, and educate licensees on efforts related to emergency and disaster planning. IPhA has had various policies on this issue. Looking back in 2011 and 2015, both recognizes the importance of the involvement of pharmacists in a public health emergency. So how did we get to this point where we are here in Illinois? The CDC and ASTHO, which is the Association of State and Territorial Health Officials, partnered together in 2013 to determine what would be the best practices going forward. And in 2015, they came out with a template memorandum of understanding. The first pilot projects were with 3 states to implement this draft MOU, and that was in Arkansas, Tennessee, and Georgia. Then in March of 2016, at the IPhA annual meeting in Baltimore, representatives from IPhA, ASTHO, CDC, NACDS, and NASPA, which is the National Alliance of State Pharmacy Associations, and representing NASPA were representatives from Missouri, Wisconsin, Iowa, and Illinois Pharmacists Associations in providing feedback to the CDC, NACDS, and ASTHO on the results of the 3 pilot programs. So out of this came a revised version of the draft Memorandum of Understanding. Illinois was selected as one of the states for the next phase of pilot programs, and we developed the Illinois Medical Countermeasures Pharmacy Work Group. And our goal is to develop and establish an MOU and investigate pharmacists' involvement in a pharmacy-only MRC, or Medical Reserve Corps. We started meeting in November of 2016. We developed the draft MOU for Illinois between December and January of 2017. We held informational sessions via web and conference call with pharmacies throughout the state back in February and March of this year. We also held informational conference calls with national and regional chain representatives and wholesalers throughout the state in May of this year. On May 31st, we had our MOU finalized by the Illinois Department of Public Health. And we are currently going through the sign-up phases, and finally, just this past week, got approval from the department to use DocuSign in facilitating the signing agreements between the local health departments and pharmacies. Additionally, this year, Senate Bill 1790 was passed and has now become law. And this was an initiative of Senator Stottleman and Rockford. And it would say that based on a pharmacist's professional and clinical judgment with a patient who has medications for chronic diseases, and that we feel that the interruption of the therapy could cause patient suffering or undesirable consequences, that we can dispense an emergency supply. The pharmacy has to have previously dispensed or refilled a prescription for this patient. They have to be known to us. It cannot be for a controlled substance. We also have to notify the patient's or the patient's agent that they will have to get a prescriber authorization for future fills. And it needs to be documented in the record, and we have to notify the prescriber. The key to this is this allows us to be able to dispense amount for the emergency period not to exceed 30 days. So this changes from the good faith dispensing that we have done previously of like a 3 to 5 day period to hold somebody over till we got an authorization. This allows the pharmacist to use our professional and clinical judgment in providing and continuing that therapy for patients. So let's take a look at the memorandum itself. So if we're going to establish a memorandum of understanding, we have to look at who are we wanting to address with this document. Whether we look at internal state health department alignment, identify community pharmacy partners, we need to complete a review process and revise of who we want to be part of this, publicize it, and of course, you got to keep up the momentum. So these are the 5 goals that was given to us by the CDC and ASTHO when we were looking at the Memorandum of Understanding development process. So what are the mutual benefits? Again, we improve the coordination before and during a pandemic. We have a stronger partnership overall, and we have faster and more efficient access to the vaccine or other medications for the public. So specific benefits. If we're looking for the public health side, again, it leverages and strengthens all of our partners, uses existing pharmacy infrastructure to increase public vaccine access points, reach full vaccine coverage of the public sooner, ensure equity among all pandemic vaccinators, and strengthen partnerships and model approaches for other dispensing and clinical services. And on the pharmacy side, we can ensure early allocation of the vaccine supply for community pharmacies, standardize operations and points of contacts, help with development of a distribution approach in advance of the situation, educate public health about pharmacy planning and response, use public health infrastructure as needed, so we're looking at balancing the use of existing infrastructure, reduce waste and improve efficiency, clarify expectations, and strengthen the partnerships with other public health for other public health emergencies as well as routine care. So looking at different components that could be part of an MOU, we need to look at pharmacy vaccinator enrollment in any training, pandemic vaccine allocation and distribution, the needed documentation. Does this also mean we need to utilize the immunization information system? So like in Illinois, what information would need to be put into iCare if iCare was available? And also vaccine payment issues, and of course communication. So provider enrollment and training. Again, pharmacies may enroll and register all pharmacy sites as possible pandemic vaccination sites. Also, that they're responsible for ensuring vaccinators have the appropriate training and certification, and also making sure that pharmacies are expected to sign the pandemic vaccine provider agreement form, and when available, require any additional documentation required by the CDC or Illinois Department of Public Health. And the states will be responsible for technical assistance, material and information and resources back to the pharmacies. So again, on allocation, we got to look at the existing vaccine capacity for pharmacies, the geographic areas and split up of our state, and looking at how best we can get the vaccine to the pharmacies in the most efficient way possible in getting it distributed to the public. So once vaccine allocation is determined, we have to decide on how it's going to be shipped to one site by the official federal contractors. And these are issues why the Memorandum of Understanding is so important, so that this complicated process has already been discussed and decided upon prior to an emergency occurring. Of course, we have to make sure, as we do with any other health service that we provide, we have to make sure we have proper documentation and that it is retrievable and sent to the providers as required. If there is payment to be decided upon and available, federal government will purchase all the pandemic vaccine and constituent products. Pharmacies may seek payment for vaccine administration, but can't exceed the established Medicare vaccination rates. Pharmacies are encouraged not to turn away patients due to the inability to pay for the administration fee. And if an emergency is established to a certain degree, the Emergency Prescription Assistance Program may be enacted by the federal government, which will allow pharmacies to utilize the payment mechanism if allowed. So again, if we're looking at communications, we have responsibilities both on the state side and the pharmacy side. So we're looking on the state side about providing planning and technical assistance to pharmacies. We have timely updates on the allocation and information to be released to the public, coordinating with the state pharmacy associations and board of pharmacies in advance, and coordinating with pharmacy to retrieve and dispose of any unused pandemic vaccine. And on the pharmacy side, again, we're going to be coordinating with the state pharmacy association, and that our representatives for our pharmacies are going to participate in all programs related to the training and education for a public health emergency, coordinating with the state to ensure statewide consistency in the implementation of all documentation and educational materials, and also making sure that we participate in all the planning discussions and any exercises that may be held throughout the year. So this is the first page of the Illinois statewide medical countermeasures strategic national stockpile pharmacy local health department memorandum of understanding. Now, throughout our memorandum of understanding, we have, and in this discussion, we have referred a lot to pandemic influenza. Our goal was to set a broad foundation for the relationship between local health departments and with pharmacies, and that additional appendices and maybe other statewide standing orders or procedures will be developed depending on different categories of a public health emergency. So ours is broken down into the purpose, local health departments, and pharmacies. We look at our purpose on the Illinois Memorandum. Again, it's to expand the capacity to distribute in a rapid fashion medical countermeasures to the citizens of Illinois. That we have a planning, training, and coordinated execution of these countermeasure distribution, and that pharmacy infrastructure will be able to assist in rapid distribution of these medical countermeasures. So now if we look at the responsibilities of local health departments, we have discussed a lot of this already from the national guidance, and that coordinating with the Illinois Department of Public Health, the signatory pharmacies, to ensure statewide consistency in screening forms, with the planning and technical assistance, with medical screening, activating the community-wide vaccination and dispensing plans, that the local health departments also notify pharmacies of approved dispensing plans and any other protocols, and with helping with release of reliable information to the public concerning the situation. So let's talk about the pharmacies. Again, a lot of this was based on the national standards, but saying that pharmacies will participate in all training and exercise requirements that the department sets forth, that will coordinate with the department and the local health departments in ensuring consistency with all forms and other materials and training. Of course, that will follow all laws and pharmacy standards, and that will receive medication securely and track its dispensing, and that will make sure that our pharmacy sites can serve the general public, and at our discretion ensure that our own employees and our pharmacy team, including maybe the employed by its parent company and their families, are also cared for during the public health emergency. So important information about our MOU. We want to make sure on the local health department side that we have the name of the health department, who our main contact is, and of course address, phone, and email. On the pharmacy side, we need to know, of course, the pharmacy name, who the pharmacist in charge is, address, phone, and email. But if it's a chain structure, each store will need to be listed separately with their own pharmacist in charge listed, and we need to have a corporate, regional, or district contacts and their phone and email. So where are we at? Like I said, we've gone through the initial stages of developing the MOU. We are finally at the signing stages. We've had various trainings. We just had a training with the local health departments, as stated earlier, at the 2017 Integrated Public Health and Healthcare System Preparedness Summit in June. And then in this month, we had another training on the pharmacy side at the Illinois and Missouri Pharmacists Annual Conference in St. Louis. We will be taking those components of those modules, including this module, as additional education and training webinars that will be available later on this year. And of course, all information to this project is available at IPhA.org. Thank you very much for your time on this very important issue as we look at the role of how pharmacists can be an important and vital player in providing care in a public health emergency.